Hello students, welcome to BioWise with Aanchal. Today we are going to cover some important topics related to your board examination. Now in this presentation, I am going to talk about the various diseases that are included in your syllabus. I have collected all of them together in one presentation for your ease. So let us proceed with the diseases. The first one is the cancer. Now, cancer, as you know, it is uncontrolled cell division. So here, what is this disease all about? This is characterized by uncontrolled and abnormal cell division, resulting in the formation of tumor that may invade surrounding tissues and spread to the other parts of the body. In this phase, cancer is called malignant. Okay, so this is uncontrolled cell division cancer. Next one is hemophilia. Hemophilia is a X-linked recessive genetic disorder in which blood fails to clot, normally due to the deficiency of one or more clotting factors, resulting in prolonged bleeding even from the minor injuries. So this can be fatal, right? It is also called the royal disease. Now, in this case, what happens in the patient suffering from hemophilia? The blood do not clot. There is a deficiency of clotting factors. Severe cases may cause joint pain and swelling, and sometimes you see bruises also present in the body. Mostly, since it is X-linked recessive disorder, so males are more prone to X-linked disorder as compared to the females. Now, color blindness is again a hereditary sex-linked or X-linked recessive disorder in which the person is unable to distinguish between certain colors, commonly the red and the green, due to the absence or defective functioning of the specific cones in the retina. You know that we have rods for the dim light vision and cones for the color vision, right? So there are certain types of color blindness, like you have protanopia, that is red color blindness, deuteranopia, that is your green color blindness, tritanopia, that is blue color blindness, and achromatopsia, that is total color blindness. So in genetics, we generally focus on the red-green color blindness because it is X-linked recessive disorder. Next one is thalassemia. Now, thalassemia is an autosomal recessive genetic blood disorder in which the body produces an abnormal form of insufficient, that is abnormal or insufficient amount of hemoglobin, resulting in anemia. So, thalassemia is again a genetic disorder. So, next is sickle cell anemia. Sickle cell anemia is a autosomal. What is autosomal? Write in the comment section. There are two types of chromosomes, autosomes and allosomes. So, what do you think? What is sickle cell anemia? Tell me what is autosomal in the comment section. Sickle cell anemia is an autosomal genetic disorder in which abnormal hemoglobin causes red blood cells to become sickle shaped, resulting in reduced oxygen carrying capacity and anemia. Now, in this case, there is a point mutation that happens. Okay. So, tell me what is autosomal in the comment section. Polydactyly. Now, polydactyly is again an autosomal but dominant genetic trait in which a person is born with more than the normal number of fingers or toes. So, maybe more than 5, 6, 7, 8 fingers can be there. So, that is polydactyly. Next is polycythemia. Polycythemia is a condition in which the number of red blood cells in the blood is abnormally high, resulting in increased blood viscosity. So, RBC is much higher than the required value, that is polycythemia. Uska ulta, that is opposite of polycythemia, is erythropenia, which is a condition in which the number of red blood cells is abnormally low, resulting in reduced oxygen carrying capacity of the blood. These terms are very important. Next is leukemia. Leukemia related to WBC. So leukemia is basically WBC ka increased in number, so blood cancer. So it's a cancer of the blood forming tissues in which there is uncontrolled production of abnormal white blood cells interfering with the normal production and functioning of other blood cells. So that is leukemia. Leukopenia is opposite of leukemia. It is a condition in which the number of WBC in the blood is very low, reducing the body's ability to fight infections. Okay. Next is myocardial infarction. Now, myocardial infarction generally causes heart attack In this case, what happens? A specific portion of the heart muscles dies because it does not get enough oxygen or blood from the coronary artery. So, myocardial infarction, commonly known as the heart attack, is the death of the part of the heart muscle due to an interruption or severe reduction in its blood supply, usually caused by the blockage of a coronary artery. So, here the muscles basically die. There is another word called angina pectoris. This is a condition in which there is temporary chest pain or discomfort due to inadequate supply of oxygen-rich blood to the heart muscle, usually because of the narrowing of the coronary arteries because of cholesterol deposit. It will later lead into myocardial infarction. So mild heart attack is angina pectoris that gives you a signal that there is some problem happening in the heart. After that, you have myocardial infarction. Okay. Next one is hypertension. It is a condition in which the blood pressure in the arteries remain persistently higher than the normal level. Please write in the comment section, write the point number 13 and write what is the normal blood pressure of an individual, of an average for human, that is adult, for adults. Okay. Next one is stroke. Stroke is the condition in which the blood supply to a part of brain is interrupted or blood vessel in the brain bursts. So by any mean, if the blood is not reaching your brain cells, and that may cause damage to the brain cells, it is called a stroke. So either it is a hemorrhage or it is a block because of the tumor or any kind of blockage in the artery. Which artery supplies blood, that is oxygenated blood, to the brain? Write 14 and write the answer in the comment section. Which artery supplies oxygenated blood to the brain? Write it in the comment section. Let me see how many of you all know this. Next one is erythroblastosis fetalis. It is a condition in which the red blood cells of a Rh positive fetus are destroyed by the antibodies produced by the Rh negative mother due to Rh incompatibility between the mother and the fetus. Now, this is the definition of the disease. If you want to understand in simple terms, if a Rh negative mother carries a Rh positive child for the first pregnancy, there is no issue. For the second pregnancy, what happens? During the first pregnancy, the mother body gets sensitized to the Rh antigen. Now, during the second pregnancy, since the mother body is already sensitive to the Rh antibody, will start that is the Rh antigen. The mother's antibody will cross the placenta, go to the fetus, and start killing the RBC of the fetus. So this may lead to the death of the fetus, or severe anemia is observed in the fetus. Then you have hematuria. We have gone to the chapter 9, that is excretory system. Hematuria is a condition in which the blood or red blood cells are present in the urine. So, urine mein the blood comes out. That is hematuria. Now, hematuria, spelling here A is missing, children. So, kindly correct it. Hematuria. This spelling is right. Okay. So, let me do that. So, you have A here. So, hematuria mein, this is a condition in which the blood or the red blood cells are present in the urine. It may occur due to infection, kidney stone, injury, or disorder of the urinary tract or kidneys. So, by any infection or any kidney stone, any rupturing of cells in the kidney or in the ureter, you get the blood in the urine. The condition is called hematuria. Next one is dysuria. Dysuria is a painful or difficult urination. What is the other term for urination? Write in the comment section. 17. Give the point 17 and write what is the term used for urination. Usually accompanied by burning sensation while passing urine. Next is polyuria. This is multiple times urination. So excessive production and excretion of urine resulting in an unusually frequent or large volume of urination. Okay, so person goes multiple times to urinate. This is basically seen in diabetes insipidus as well as diabetes mellitus. Next one is glucosuria. Now, glucose, if you remember in the excretory system chapter, that glucose is an essential biomolecule that is reabsorbed in PCT, that is proximal convoluted tubule, in the second step of urine formation, that is reabsorption. So, if glucose is passed into the urine, that means the kidney function is not happening properly, or there is an elevated level of glucose in the blood. So glucosuria is a condition in which glucose is present in the urine, usually because the blood glucose level exceeds the kidney renal threshold for glucose reabsorption. Albuminuria. Albuminuria is a condition in which the protein albumin is present in the urine, indicating that the kidney are not adequately preventing the loss of protein from the blood. That means kidney is not filtering well, not functioning well. Next one is gout. Gout is a metabolic disorder caused by accumulation of uric acid in the blood. Now you remember uric acid is less soluble as compared to urea. So uric acid crystallizes out and basically it starts getting deposited in the joints, leading to a formation of urate crystals in joints and causing severe pain and inflammation too. That is a kind of arthritis. So gout is uric acid crystal in the joints. Kidney stones. Kidney stones are hard crystalline deposits formed in the kidneys due to the accumulation and crystallization of certain dissolved substances in the urine. Okay, so kidney stones again may interrupt the urine flow and may cause pain, discomfort while urination. Common substance forming kidney stones include calcium oxalate. Maximum of the kidney stone is by calcium oxalate, calcium phosphate, and uric acid. Next one is hepatitis. Now, children, hepatitis, jaundice, these diseases I have mentioned here, they are not directly into the lesson, but they are, what to say, if because of these diseases, bile pigment starts getting released in the urine. Okay. So these words are mentioned in the excretory system chapter. So hepatitis is an inflammation of the liver, usually caused by viral infection, which can impair the normal functioning of the liver. Common types include A, B, C, D, E. Some forms are spread through contaminated food and water, while others spread through infected blood or body fluids. Next one is jaundice. Jaundice is a condition in which the skin, mucous membrane, and the white of the eye become yellow due to the increased level of bilirubin in the blood. Since kidney is not filtering it out, liver is also not able to, remove these waste. It gets accumulated in the blood. So jaundice may occur due to liver disorders, obstruction of bile flow, or excessive destruction of red blood cells. So bilirubin basically is removed in the process of defecation. Name the pigment which is present in urine. That is also a pigment that is produced by the breakdown of hemoglobin. But what is the name of the pigment which gives coloration to the urine? Write 24 and write the answer in the comment section. Next one is liver cirrhosis. Now, liver cirrhosis is a chronic disease in which normal liver tissue is replaced by the scar tissue, resulting in impaired liver function. Now, you know that your liver has a capability of regeneration. One third of the liver is there, healthy, it will grow into the complete liver. But if the liver cells are killed by any mean, then they are replaced by the adipose tissues that causes fatty liver and scar tissues which causes liver cirrhosis. Common causes include long-term excessive consumption of alcohol, chronic hepatitis infections, and certain other liver diseases. Next one is anemia. Anemia is actually a group of disorders. You can say thalassemia, sickle cell anemia. They all come under anemia. So anemia is a condition characterized by deficiency of hemoglobin or red blood cells in the blood, resulting in reduced oxygen carrying capacity. Some causes include like iron deficiency, vitamin deficiencies, blood loss, certain inherited disorders such as thalassemia. Anything can be the cause of anemia. Next, you have cholera. Cholera is very important because here they talk about ADH. Okay, so cholera may basically what happens since the person is passing out watery stool, the osmoregulation is triggered in our body. So the brain senses, that is pituitary cup posterior lobe, will send a signal. ADH will be released in a higher amount for reabsorption of water in the kidney. So ultimately what happens, the person who suffers from severe cholera will not urinate. So urea level will increase in the blood, causing uremia. Uremia is a disorder in which the urea level increases in the blood. So cholera is an acute bacterial disease of intestine caused by Vibrio cholerae, usually transmitted through contaminated food and water, characterized by severe watery diarrhea and dehydration. Severe dehydration, no urination, so urea level will increase, causing uremia. write down, you keep a note of it, okay? Uremia. Next one is conjunctivitis. Now we are going to the sense organ part. So conjunctivitis, that happens, the red color eye and all you have seen. So conjunctivitis is an inflammation of the conjunctiva and the thin transparent membrane covering the white part of the eye and the inner surface of the eyelids caused by infection or allergy. It can be viral or bacterial. Okay. Now, if you have not subscribed the channel, you are requested to subscribe and then move ahead. Okay. Moving to the next is myopia. Myopia is a defect of vision in which person can see nearby object clearly but cannot see the distant object. So myopia, since you can see the near objects and cannot see the farther objects, myopia is called what? Short-sightedness. Okay? And the eyeball is too long. The curvature of the eye lens is too great, making it too powerful. You can say that. Actually, the curvature of the eye lens is shortened. Image formation. The image of the distant object is formed in front of the retina instead of on the retina. It is corrected by a concave lens or a diverging lens, which diverges the incoming light rays so that the image is formed on the retina. Next is hyperopia, that is long-sightedness. You can see the distant object, but you cannot see the closer objects. The curvature of eye becomes too small. In that case, it was myopia, it was elongated. Here it is too small. Eyeball is also short. So the image is formed behind the retina instead of on the retina, and it can be rectified by using convex lens. Okay. Next one is astigmatism. Astigmatism is basically the eye cannot focus light evenly on the retina, causing blurred or distorted vision. Now, the cornea has an irregular or uneven curvature in this case, and sometimes curved lens is also irregular. So all the images points are different in different places. So you can see some things and sometimes you cannot see the other things. This problem happens when you have lines, like you have 4 vertical lines and 4 horizontal lines. So maybe if a person is suffering from astigmatism, can see few lines only properly. So light rays of an object are not focused at a single point on retina, resulting in a blurred or distorted image. Astigmatism can be corrected by using cylindrical lens. Okay. Next one is presbyopia. This is old age ka problem. So it's the age-related defect of vision in which eye gradually loses its ability to focus clearly on the nearby objects. Reason is the muscles holding the eye lens. Name the muscles holding the eye lens. Write 32 and write the answer. The muscles holding the eye lens. Now, loss of elasticity of the eye lens with age, weakening of the ciliary muscles, reducing the power of accommodation. Image formation is basically behind the retina. It is similar to your hyperopia. The only thing is it happens with the age. And then corrective measure is using convex lens. If a person has both myopia and presbyopia, bifocal and progressive lens can also be used. Generally, old people you see they have progressive lens as well as they have the normal lens, bifocal lens so that they can see the farther objects also clearly and closer objects also clearly. Next one is cataract. Cataract is a condition in which the eye lens become cloudy or opaque, causing blurred or impaired vision. What happens? You have a lens in the eye. That lens has to be transparent, right? So with the age, what happens? Protein starts getting deposited on your eye lens, making it opaque. So that is also in Hindi, it is called motia bind. You have white color ka pearl-like thing starts appearing on your eye. So when it is completely covered, then the doctor removes that lens, put another artificial lens that is called the artificial intraocular lens, and the person resumes the vision. Night blindness, vitamin A deficiency. So it's a condition in which a person has difficulty seeing clearly in dim light or at night, commonly due to vitamin A deficiency. So here, night blindness is a deficiency disorder. Rest color blindness is a genetic disorder. So difference between color blindness and night blindness can be asked. Okay. Moving to the next, corneal opacities. Now, corneal opacities is a condition in which the normally transparent cornea is the outer layer, right? Becomes cloudy or scarred, interfering with the passage of light into the eye, causing blurred or reduced vision. Treatment depends on the cause and severity of the problem and may include medication, treatment of underlying condition, corneal transplantation in severe cases. Cornea transplant is an easy transplant because there is no blood supply to the cornea. This is again a question why cornea transplant is easy as compared to any other transplant, right? Because there's no blood vessels involved. Squint, looking London, talking Tokyo, right? The squint is a condition in which two eyes are not properly aligned. So the one look in the other direction and this at the same time the other one looks in the other direction. It may be corrected by using glasses, eye exercises, patching or surgery, depending upon the cause and severity. So next one is Addison's disease. Now we are talking about the diseases in the endocrine system chapter. So Addison's A comes first and C comes later. So Addison is hyposecretion of the adrenal cortex gland secretions, that is hormones, cortisones, and Cushing syndrome will be hypersecretion of the cortisones. So Addison's disease is a disorder in which the adrenal cortex gland produce inefficient amount of cortisones. Okay, so here you will have hypoglycemia subless, hypoglycemia, too thin, high metabolic rate, always tired, always fatigued. Similar in Cushing syndrome, the person will be obese with hyperglycemia, right? And it is a disorder in which prolonged exposure to abnormally high level of cortisones. So they will also develop a kind of hump. Okay, that is your Cushing syndrome. Next one is adrenal virilism, very important from board's point of view. It is a condition in which adrenal glands produce excess androgens hormone, which causes the development of masculine characteristics, particularly in females. The female will have a mustache and a beard, and if it happens in the males, they may develop breast. Diabetes mellitus is a metabolic disorder in which the blood glucose level remains abnormally high due to the insufficient insulin production or ineffective action of insulin or both. So either your pancreas is not making insulin properly. Now write 40 and tell me which cell of pancreas is responsible for insulin. Which cell of pancreas is responsible for insulin? Okay. So insulin production in ineffective action of insulin or both. Okay, so types there are two types. Type 1, that is diabetes mellitus, and type 2, that is diabetes mellitus, insulin independent and insulin dependent. Okay, so the first one is insulin dependent. So it requires a lifelong insulin therapy. In this case, what happens? The pancreatic beta cells are destroyed, resulting in no insulin. And since there is no insulin, it is insulin dependent. In therapy, you have to provide insulin to the patient. Diabetes mellitus is insulin resistance. It is basically insulin independent. The insulin is being produced in your system, but your cells have become resistant to it. So in that case, healthy diet, regular physical activities, weight management, and medicines can help. Okay. Next one is diabetes insipidus. Diabetes insipidus is the hyposecretion of ADH or vasopressin by your posterior lobe of pituitary. So in this, what happens? It is an inability of the kidneys to respond to ADH, resulting in excessive production of dilute urine and intense thirst. Okay. Next one is cretinism. Cretinism, C for cretinism, C for children. So cretinism is actually in children. Cretinism is a condition caused by severe deficiency of thyroid hormone during fetal development or early childhood, resulting in impaired physical and mental development. This is hyposecretion of thyroid glands. Okay, hypothyroidism. Cretinism is also called hypothyroidism. Always remember cretinism, C for cretinism, C for children. Maxodema, that is myxodema, but here you have max. The max is for adults. So hyposecretion of thyroid gland, that is hypothyroidism, causes myxodema in adults. So myxodema is a severe form of hypothyroidism in adults caused by insufficient secretion of thyroid hormones, resulting in a slowing of body metabolism. Okay. Next one is exophthalmic goiter. Now, exophthalmic goiter is hyperthyroidism. Everything is hypo. You have goiter, cretinism, myxodema. Three diseases for hypothyroidism and exophthalmic goiter, one disease for hyperthyroidism. It is also called Graves' disease. The eye becomes protruding out. Okay, there's protruding eyeballs and enlarged thyroid glands are the characteristic of this disease. Next one is goiter, that is hypothyroidism, commonly caused by iodine deficiency, although it may also result from other thyroid disorders. The thyroid gland actually enlarges itself in a hope that it will make more thyroxine, but that does not happen. Okay. Next one is dwarfism. Dwarfism is a condition characterized by abnormally short stature, often caused by the hyposecretion of growth hormone, that is a hormone released by anterior pituitary during the childhood. The person becomes very short. Okay. Gigantism, that is a condition caused by excessive secretion of growth hormone during the childhood, resulting in abnormally excessive growth and very tall structure. So they are extremely tall with big hands, big face, big jawline, right? That is giant. So acromegaly. Acromegaly is a condition by excessive secretion of growth hormone in adults, resulting in enlargement of the bones of both hand and feet and face. So here the face becomes big, the feet and the hands are extremely gorilla-like, that is too big. Then you have hypoglycemia. Now, hypoglycemia, hypo means less, glycemia is glucose. It is a condition in which the blood glucose levels fall below the normal level, usually due to excessive insulin secretion or inadequate intake of glucose. The main causes include excessive secretion of insulin by pancreas, overdose of insulin. Basically, what happens, no, the people who are insulin dependent, so they take the medicine, insulin, they take the injections. Even if the small dose of insulin is given extra, so they may go under insulin shock. That is hypoglycemia, and the person may faint or become unconscious, even can slip into coma. Okay. Prolonged fasting or inadequate intake of food, excessive physical exercises without adequate amount of food intake, or certain disorders of liver or endocrine glands may also lead to hypoglycemia. And the last one, hyperglycemia. It is similar to diabetes mellitus, but other things also add up to the increased level of glucose, even if you don't have diabetes. So it's a condition in which the blood glucose level rises above the normal level, usually due to insufficient secretion of insulin. What happens in diabetes mellitus, or oversupply of sugar, you can say. So first cause is insufficient secretion of insulin, that is diabetes mellitus. Excessive intake of carbohydrate, but this is very momentarily. If your body is fit, it will regulate the amount of glucose in the blood. Lack of physical activity, stress, or illness can also increase the blood glucose level. So with this, you have mastered 50 disorders and diseases for the board examination, children. So congratulations for that. And yes, if you really like the content of my channel or the way I present my classes to you, you subscribe the channel and also share with your friends if you think it will be helpful to them. Thank you so much and have a great day.